Welcome to Prehistory Data Management. I'm Dr. Michael Warner with Patient Advocacy Initiatives. Before we get started, please answer 3 quick questions. When introducing the concept of a prehistory to doctors, the initial concerns tend to be 1. What if the patient writes too much? 2. What if the patient lies? And 3. How will we have time to address all the patient's concerns? 4. How will this affect my exposure to medical malpractice lawsuits? One thing to be clear regarding the history, let alone the prehistory, there is only one history per medical encounter. Chief complaint, history of present illness, status, review system, past family social history. The history and the prehistory need to be to the point. The patient needs to tell his or her story, but it also needs to be readable in size. In our clinical research study, 263 patients completed a prehistory prior to an office visit with the family doctor. The average chief complaint, HPI, and status of chronic diseases and conditions amounted to about 4 lines of text. Patients who were very detailed gave 6 lines. Fears that patients would write 50 pages were unfounded. If a patient completes a prehistory and modifies it to be too long, then you should advise the patient to watch or rewatch this series. In your practice, I am sure that you have patients that take a long time to see. These patients have detailed concerns and a long list of them. During the visit, it seems to take forever to determine all of their concerns. This is also the kind of visit that generates many late concerns, also known as by-the-way topics once you leave the room. I found that the prehistory works great for these patients. Much like the elephant fable, these patients have a detailed story, and once they assembled all of their concerns on a prehistory, then it was made into a documented case in the history component of the encounter note. I was able to read the patient's subjective account, which took about 30 seconds, and then I was able to reaffirm what was communicated. You tell me this and this and this are going on? And the patient would say yes, knowing that they had been heard and understood. From there, I asked more detailed questions. These questions were the type that I may have never gotten to when I worked as a doctor/stenographer. With the prehistory, I was practicing medicine. As the government is pushing for patient-generated health data and patient engagement with the health record, it will be only a short period of time until all portals have a prehistory option. Until this occurs, you can use our free paper prehistory. Patients will struggle to find the right words and the right amount of words to complete the prehistory. I recommend not having your patients complete a prehistory in the waiting room or the exam room. It is too rushed and it puts too much pressure on the patient. Many of our patients in the research study reported that they completed the prehistory and then sat it on the kitchen table. When they would walk by the table, they would occasionally stop and add or modify. Patients value the chance to assemble their thoughts at their own pace. They also value having the opportunity to reflect on the questions in anticipation of a visit with the doctor. The mission of our organization is to help support patients and health staff members moving forward. And we'll do this with an interactive Facebook page and our YouTube Patient Advocacy show. We will be sure to keep everything archived on our website as a reference for you. I found no evidence of patients lying on the prehistory form. More often, patients would downplay a concern, prompting me to clarify the issue. If a patient misunderstood something, then the prehistory would allow for me to recognize the misunderstanding, thus giving me an opportunity to clarify. During our study, we kept to a 15-minute practice schedule. We did not allow for more time if a patient presented with a prehistory. Because our patient portal did not have a prehistory option, this meant that our staff members had to complete the task of scanning the prehistory into the EHR and naming it a prehistory. Staff members also had the task of transcribing the content of the prehistory into the history section of the EHR encounter note. I would rather devote energy into accommodating a prehistory as a request to amend the record than promote amendments after the visit. Using the prehistory as patient-generated health data and as an amendment, we were able to bill for the medical encounter. This contrasts with the efforts to correct the record at a later date and link and modify which you must do for free. The last issue is malpractice lawsuits. Patients who completed a prehistory reported that they felt better heard and understood. They appreciated having the chance to contribute to the record. And when patients reviewed their encounter note after the visit, they scored the note high for accuracy and proper content. Patients ranked their experience as a patient with a satisfaction score of 97%. The doctor who orders a transfusion to a patient who is anemic and bleeding and forgets to check another blood level, and the patient dies in the hospital 8 hours later because he or she bled to death, that doctor should be sued. Lawsuits that plague the field of medicine today, however, are often based on the patient saying one thing and the doctor saying another. With excellent documentation, which big data wants for analysis to improve healthcare, quality, cost, and satisfaction, and with information that the patient generates, we should expect lawsuits to drop. If we let the regulatory machine run wild and we spend most of our day reviewing patient requests to amend old records, then doctors will dig themselves into a malpractice trap like we have never seen. We can manage this data. EHRs were designed to do it. We just need to partner with our patients and empower them to use their newfound patient rights. Follow me to the next module where we will perform an access drill. Thank you for watching this module. And before you go, please answer 3 quick questions.